Traumatic brain injury biomarkers 1 year in, words of inspiration from the CAP president, and a public health advisory on New World screwworm. Coming up next. This is the Path News Network Daily Edition, powered by the College of American Pathologists. I'm Sivan Burrell, sitting in today for Nancy Johnson. It's Friday, January 30th, and here are the latest headlines. Blood-based biomarkers are beginning to change how traumatic brain injury is evaluated in emergency departments, but successful adoption depends on how those tests are implemented. In a recent CAP Today cover story, clinicians at Michigan Medicine report on their first year using 2 FDA-cleared biomarkers to help guide decisions about brain CT imaging after trauma. Dr. Frederick Corley, professor of emergency medicine at the University of Michigan Medical School, says the tests were introduced to reduce unnecessary imaging while maintaining patient safety. Quote, "We wanted to get a good sense of how the tests would work in our own hands." After 1 year in clinical use, the biomarkers show strong negative predictive value, helping clinicians avoid low-value CT scans while improving emergency department throughout the patient care. Take a deeper dive by visiting the link in today's show notes. As a new year unfolds, the focus for pathology isn't just on new tools or technologies, but on leadership, purpose, and inspiration. In a recent column from the President's desk in CAP Today, CAP President Dr. Jim Jai reflects on the role pathologists can play in shaping the future of the profession. He encourages pathologists to look beyond daily responsibilities and consider how they can mentor future colleagues, engage more deeply with the CAP, and advocate for laboratory medicine within their institutions and communities. He also says meaningful change happens when pathologists share their experience, raise their voices, and take an active role in guiding the next generation and advancing the field. Quote, "I truly believe we have even more to offer to our patients, to the general public, and to each other. It just takes the spark of inspiration." Public health officials are monitoring a parasitic outbreak moving closer to the U.S. border. Recently, the Centers for Disease Control and Prevention issued a health advisory after new cases of New World screwworm were reported in the Mexican state of Tamaulipas, which borders the United States. The outbreak has spread across parts of Central America and Mexico. As of January 20th, more than 1,190 human cases and 7 deaths have been reported. The screwworm fly has not been detected in the United States, and officials say the current risk remains low. Guidance is available for clinicians and laboratories in the event of suspected cases. You can review the full advisory by visiting the link in today's show notes. And finally, a healthcare system in the Middle East has reached a major laboratory quality milestone. Government Hospitals Administration in Bahrain announced its medical laboratories has earned accreditation from the CAP, meeting international standards for testing accuracy, patient safety, and laboratory operations. Dr. Mariam Atbi Al-Jalama, Chief Executive Officer of Government Hospitals, says the achievement reflects ongoing efforts to strengthen diagnostic services. Quote, "Obtaining CAP accreditation is part of our ongoing efforts to advance diagnostic services and develop the healthcare system." Learn more about Government Hospitals Administration in Bahrain by visiting the link in today's show notes. That's all we have for today. You can find us on Apple Podcasts, Amazon Music, or Spotify. Subscribe on your favorite platform. Look for more news like this in our weekly newsletters published every Tuesday and Thursday. We'll be back tomorrow at 5 a.m. Eastern Standard with more CAP news. For the Daily Edition, I'm Sivan Burrell. Have a great day.